RECOVER-4 is a research study of patients with heart attack who develop heart shock. Heart shock is when a heart attack is so large that the heart cannot pump enough blood to the body. Heart shock is a medical emergency. Nearly half of patients with heart shock die before leaving the hospital. Therefore, treatment of heart shock usually starts within 1 hour of hospital arrival. Usually, doctors treat heart attacks by quickly inserting a long, thin tube through a blood vessel in the arm or leg to open the blocked artery that caused the heart attack. RECOVER-4 will study a temporary heart pump called the Impella CP. The U.S. Food and Drug Administration has approved its use in patients with heart shock. A doctor places this pump in the heart through blood vessels via another long, thin tube. This pump helps the heart get more blood to the body. Sometimes a temporary heart pump is used to treat patients with heart shock, and sometimes it is not. The best treatment approach to improve survival from heart shock is unknown. This study is being done to learn if using the Impella CP heart pump helps patients with heart shock recover better compared to other treatments. The study team will enroll eligible patients who arrive at participating hospitals. A computer will randomly assign patients into one of two groups. Half of participants will receive standard treatment for heart shock with the Impella CP heart pump. The other half of participants will receive standard treatment for heart shock without the Impella CP heart pump. Those who receive the heart pump will have it placed in their heart for at least 24 hours, then removed when their doctors think it is safe and appropriate. Potential benefits from the Impella CP include smaller size heart attacks, less time in the hospital, improved quality of life, and better survival. Potential risks of the Impella CP include bleeding, stroke, infection, heart rhythm problems, and damage to the heart and blood vessels. Risks may be caused by the delays with putting it in. There may be other risks. The study team will monitor patients while they're in the hospital and for 1 year after the procedure. Usually, doctors ask their patients if they want to participate in a research study. This is called informed consent. In this study, the research team will spend up to 15 minutes trying to communicate with patients or someone who can speak for them to see if they would like to join the study. If a patient or someone who can speak for them is able to talk, they will be asked to give informed consent before the patient is enrolled. Heart shock is a life-threatening emergency. Treatment decisions must be made quickly. Due to their illness, most patients will be too sick to be able to give their informed consent. In these cases, research rules allow studies like this to enroll patients without their consent. This is only allowed if the best strategy for care is unknown and there is a potential benefit to patients. If you are enrolled in this study without your consent, you or your family member will be told as soon as possible. Individuals in the community may opt out of the study ahead of time, contacting the study team. It is important for the study team to hear from members of the community where the research will take place and where patients go for emergency care. After watching this video, we ask you to provide your feedback about the study. You can complete a brief, confidential survey by visiting our website.